We have the gastrointestinal changes in pregnancy. We have the stomach and we have the large bowel. In stomach, we have low gastric motility and high emptying time, thanks to the progesterone, which is responsible upon these two, low gastric motility and high emptying time on the smooth muscle. Progesterone, the main function of progesterone is a relaxing smooth muscle, as well as these that I already said before. And here we have the increase in the stomach residual volume. In the stomach we have high residual volume, and in the pulmonary we have low residual volume. Upward displacement, why this is occur? Upward displacement of the intra-abdominal content by gravid uterus predisposes to aspiration pneumonia with general anesthetic at delivery. So why do we have residual volume? Because of the progesterone. Progesterone relaxes smooth muscle in the stomach, and here the gravid uterus try to push the diaphragm. Therefore, the stomach try to push upward, and during general anesthesia we got aspiration pneumonia. And here we have the large bowel. In large bowel we have low colonic motility and high transit time from the progesterone effect on smooth muscle, leading to high colonic fluid absorption, resulting in constipation. So in large bowel we have constipation. In stomach we have aspiration pneumonia. And here we have to keep in mind progesterone is responsible of three of those. First one is decreasing gastric motility, delay emptying time in stomach, and low colonic motility and high transit time in large bowel. And finally we have the last function of progesterone, which is a thermogenic effect of a basal body temperature. And here we have the pulmonary system. Pulmonary system, we have high tidal volume and high minute ventilation, high residual volume, and finally blood gases. We have respiratory alkalosis, we have alkalotic urine because of the high pH and low carbon dioxide pressure. And here we have tidal volume. What's the definition of tidal volume, or what do we mean by saying tidal volume? Tidal volume is the volume of air that moves in and out of the lungs at rest. Tidal volume increases with pregnancy by 40%. The only lung volume that does not decrease with pregnancy. This can be MCQ question. And here we have minute ventilation, and decreases up to 40%, major increase by 20 week. Minute ventilation, which is a product of respiratory rate and tidal volume. Minute ventilation is equal to respiratory rate, which is unchanged, and tidal volume, which is increasing steadily throughout the pregnancy into third trimester. And here we have the residual volume, which is the volume of air trapped in the lungs after deepest expiration, and residual volume, which can be low up to 20% by the third trimester. To a great extent, this is because of the upward displacement of the intra-abdominal content against the diaphragm by the gravid uterus. We have the blood gases. We have high tidal volume, as we said before, produces respiratory alkalosis. Also, this can be MCQ. We have low pressure of the carbon dioxide from 40 till 30 millimeter mercury. We have high pH 740 to 745, and high renal loss of bicarbonate helps compensate, resulting in alkalotic urine.